Good morning, good afternoon, good evening to all of you. My name is Thomas Kergal. I'm working at the Council of Europe Development Bank, and I'll be your moderator for this webinar. We'll wait 1 or 2 more minutes to make sure that everybody connects, and we'll start. So I guess we'll be starting now. It's my pleasure to be here with you, and I'd like to thank the organizers for inviting me to moderate this exciting webinar, I believe. Thanks to all of you who are connecting now from east to west and south to north. It is exciting indeed because this is the first webinar organized by the Future of Hospital platform. As you may know, this platform is actually an initiative that was launched in June 2023. And it is carried by a set of international partners that are present today, such as development banks, research institutions, health operators, and institutions in healthcare and NGOs. The objective of the platform is, in fact, to be a space for dialogue between all partners who wish to contribute and exchange on the transformation of health systems, and in particular transformation of hospitals. So the aim of this first webinar today is to discuss these transformations and possibly identify solutions for their financing, in particular with the support of public development banks. So how are we going to do this? We thought that it would be that we would first try to define the challenges of this transformation. Then we'll give the floor to its actors, to the stakeholders participating into that transformation. And finally, we will have 2 development banks presenting how they meet the needs of their partners. So as a moderator, I've spoken already too much. I'll turn right away to Agnes, who will be making a thorough introduction, presenting the objectives of the working group and giving a broader picture in a global context. If you please, Agnes.
Thanks, Thomas, and thanks to the CEB for co-hosting this webinar. Thanks for all of you who are here today to join this really interesting conversation about the future of hospitals. And thanks also to all the speakers for their time today. I want also to give a special thanks for all the members of the platform, Future of Hospitals, and especially the team of the International Hospital Federation, the IHF, especially the Geneva Sustainable Center for the organization of this webinar. So what is the Future of Hospital platform? This is really a knowledge sharing space that aims to highlight existing tools, bridge gaps, and share the best practices fitting the specificities of tomorrow's healthcare systems and hospital facilities. The initiative aims to pave the way for the founding of resilient and sustainable hospital and healthcare systems. This initiative is open to all international institutions and partner countries which want to participate to achieve these goals. As a whole, the platform pursues 3 main objectives. First is open an agora for the exchange of expertise and good practices regarding hospitals and healthcare infrastructures in order to operationally implement the transformation of hospitals following global recommendations towards 2050 and the Glasgow Climate Agenda perspective. Second is to support public development banks, healthcare professionals, and interested stakeholders into elaborating expert content and know-how to guide a sectoral approach on climate resilient, sustainable, and adaptive models for future hospitals. So it's really about linking knowledge with investment, financing, and operations. And this all to build an operational alliance to foster a transformational agenda for the hospital sector at policy level. That's the third objective, that is transformational, and enabling other field actors to embed future recommendations in their hospital projects. What we know is that health systems did not benefit from the right level of investments before the COVID crisis hit in 2020, and a lot has been written about this. And this lack of investment has been nowhere more felt than in what we can call the systems foundations, such as human resources for health and infrastructure. And we all remember these countries hit by the COVID crisis who did not have enough capacity to respond in their hospitals. And we all remember the extraordinary effort of health workers to respond to the crisis, spending countless hours in caring for people affected by the epidemic. Indeed, when we look at the global health spending patterns, we see that since 2000, there has been little progress in health system capacity in the developing world. Most ODA, for example, between 2000 and 2019, which was peaked at about 25 billion per year for country-level investments in 2019, this ODA has been mostly directed toward the purchase of medicines and vaccines for a limited set of well-known disease and killers and a limited number of beneficiaries. Generally, development aid for health has provided negligible funding for human resources and infrastructure. And when it comes to infrastructure, mostly through public development banks and particularly multilateral development banks. The shortage of health workforce is nevertheless global today, has been highlighted by the crisis, but nowhere is it more felt than in the developing world. We both had lagging investments in those fundamentals. If we take infrastructure and human resources for health, they represent about 80% of the spending on health at country level. So this is where these foundations have systematically lacked constant investments in the developing world over the past 20 years. Good news is that healthcare systems have started to conduct a broad transformation post-COVID. There is a realization that health systems need to improve their resilience and the healthcare delivery models need to be transformed. Yet, there are many challenges. The COVID-19 pandemic has certainly highlighted the importance of health, both in triggering social welfare as well as economic benefits. But care provision has often been set back during the crisis. And certainly now, 4 years after the pandemic erupted, the health is again backwards among the priorities of the international agenda and international partners. There is no real response in terms of investments to pandemics without a significant and quality healthcare offering, and health systems must be strengthened in a broad approach, and that requires investments in both infrastructure and human resources for health. We know also that in the long term, the climate crisis will significantly affect the framework of stakeholders and will lead us to commit to support another transformation of health systems that is needed towards resilient, sustainable, and low carbon trajectories. And we need health systems that are capable of responding to these different structural challenges at the same time, whether they are the challenges, the epidemiological challenges, such as the pandemic risk, but also the epidemiological transition with the rise in the need for healthcare for non-communicable disease, particularly diabetes and cardiovascular disease, but also the demographic issues, including aging and the rapid increase of population in some parts of the developing world that will see an increase in the need for maternal and child health. And for all countries, the UHC agenda, Universal Health Coverage, that calls for equal access to care and is currently set back with a plateauing of the access globally at about half of the current population. Healthcare organization and delivery have to therefore rethink how to fund and invest, to fund healthcare, invest in health system, both thinking about the healthcare continuum and thinking about how to address the inequities of access, particularly through territorial approaches. In sub-Saharan Africa, for example, to date, only half of primary healthcare facilities have access to clean water and adequate sanitation, and only a third have access to reliable electricity. There is really a need to rethink how we orient and channel funding towards these sustainable and resilient health systems. What is the challenge today, and what is the opportunity? Our value proposition with the platform of the future of hospitals is that development banks, public development banks, have a key role to play in accelerating the needed transformation and improving the response to the needs of tomorrow in terms of health investment. In 2021, the G20 actually recognized the important role of public development banks towards the achievements of the SDGs and the Paris Agreement goals. We know that over the past 2 decades, there is more and more demand for healthcare, and spending on health, particularly public spending, has increased globally much faster than economic growth. Actually, recent data that come from the national health accounts and are published today, which is UHC Day globally, show that the spending on health in 2022 stabilized above the level of spending on health in 2019. So the crisis has led to prioritizing investments in health, both publicly and also as a response to the crisis. Most countries do need accelerated investments in healthcare institutions, increased investments to develop their green infrastructure, zero-emission hospitals, and energy-efficient hospitals, but also their public health institutions that will allow them to progress further towards universal health coverage and address this vexing problem of the plateauing of the progress on access to care. What is little known is that public development banks, and that include the big multilateral banks such as the World Bank or the Asian Development Bank or the Inter-American Development Bank, but also bilateral banks, national banks, multi-country banks such as Afrexim Bank that responded very rapidly during the pandemic crisis in making funding available for vaccines, for example. These public development banks are critical players of the global financing architecture. In fact, together, they currently manage about 23 trillion, which is 23,000 billion of total assets. This represents up to 2.7 trillion of annual investments, which is a staggering 12% of the total amount invested in the world each year by all public and private sources combined. So here we're talking about 100 times more than what is actually spent on healthcare by ODA. In conclusion, in light of the urgent need for investments in healthcare system and significant transformation of these systems, public development banks, with their capacity to mobilize funds at all levels, subnational, national, multi-country, regional, and global, provide cross-cutting interventions, but they also deliver technical assistance and can support public policy initiatives. Public development banks lend mostly to governments. We're talking about public money. However, despite the pressing needs, access to care, beyond the primary health investments mostly focused on the access to medicines, remains underrepresented in the portfolio of investment banks. Very few banks actually prioritize these investments in hospitals, in the training of health workers as a way to develop good jobs for young people in the country. We really hope that the future of hospital platform and its dedicated group of development banks together in the Finance in Common Summit initiative aim to support this institution in helping structuring their investments towards enhancing healthcare accessibility. Thank you very much, and I'm looking forward to the discussion and conversation with you. Thank you.
Thank you, Agnes. That was very, very clear. Indeed, we are facing great challenges after COVID with climate change, etc. You made a very comprehensive picture of the challenges and the objectives that are awaiting the health community and the platform, as you said, linking knowledge with investments and operations. You've made a very clear picture of the challenges that human resources are facing in the future. So at this stage, I'd like to give the floor to Christophe Lemierre from the World Bank. And Christophe will tell us about the added value of the initiative that we're looking at. Please.
But I wanted to start with a special focus on hospitals, which also I believe have been sometimes neglected by multilateral development bank, at least some of them, which is quite unfortunate for all the reasons that were mentioned by Agnes. I would just elaborate on three more. I mean, one is that there's the switch to non-communicable disease, meaning that I don't know if it means we need more hospitals, but we need more specialized care, which may not be something much discussed, but I think that this is quite an important point that we see in many countries, and this specialized care can be based in hospitals or not, but at least some linkage with hospital capacities are needed. And really, I think that this switch is absolutely crucial, and I have seen it, for instance, in Asian countries. A second reason, and also mentioned by Agnes, I mean, is this this need to invest massively in human resources for health. That's really a key bottleneck to improve the capacity of health systems. And definitely hospitals have a role to play there. I mean, at least in terms of training. And finally, there is this climate change agenda. And again, I mean, probably hospital facilities more than I would say other facilities like primary care ones, I mean, have a significant role to play. I mean, in the reduction and mitigation agenda. And actually, I gave the example of something we have been working on green hospitals in Thailand, and I'm sure there are similar examples elsewhere. But just to show that with quite not huge investments, I mean, that there can be really tremendous benefits in energy efficiency or investing in solar panels. Which is really something that you will find mostly in hospitals. So that's where the hospitals can really have the biggest contribution of the health sector to the climate change agenda. Now to move on the development bank advantage in investing in hospitals and more generally in health system. I think that of course definitely it's easier for us to have this health system approach compared to other colleagues. We have also this ability to combine funding with technical assistance, and something which may be small, but I think that most of these development banks have built very quickly expertise in climate finance. And again, this is crucial to move on this agenda. So if we can move to the next slide, which I don't see, but I hope it's okay, Thomas.
I think we're on the next slide. Yes, please.
Okay, and that's my last one actually. So what the platform could do, I understand there will be, of course, further discussions on that, and definitely there is a lot of, as was said earlier, I mean, on knowledge sharing, on the best practices and so on. But I really wanted to insist on the fact that this platform, in my view, would be a really the right avenue to document some important points, because this the business case for investing in hospitals is not always super clear among at least some development banks, and I think I would say some internal advocacy may be needed, and to do that you need a bit of technical analysis, or at least some homework on that. One is the one I mentioned earlier. I mean, is the impact of the switching to the epidemiological transition. I mean, the fact that we are switching increasingly to NCDs, and that's the case everywhere. I mean, I was just checking, for instance, with sub-Saharan countries, in about 20 years, more than half of the burden of disease will be with NCDs. And you can add also that a lot of the population is getting urbanized. So I think there is really a quite big urgency to rethink the kind of models of care we are working on, that it cannot be just primary health care. I mean, it has to be much broader than that. A second point that can be helpful, I think, in this internal advocacy is to elaborate more on vertical integration. That may sound not very new because we have been talking about that for years, but I think that few countries are getting really serious on vertical integration. And I mean by that they are moving to some legal changes with, for instance, hospitals becoming the owners of some ambulatory facilities, which can be primary ones, which can be specialized. I think the example of China, among many others, is extremely interesting on that. And I believe this is something that should be even more documented and disseminated. And the final point is on the green hospitals. Again, I'm not going to repeat what I said earlier, but this is where hospitals can have a big role. And I have the impression that we can do more on documenting the potential of hospitals on this agenda. And that's it from me. Thank you, Thomas.
Thank you, Christophe. I think this is very clear. Thank you for indeed clarifying the added value that the platform can bring and the issues that are at stake. And indeed, we cannot touch upon these issues without also considering the resilience of the healthcare system. So I'd like to give now the floor to Carl Blanchet, who will give us a bit of background on the concept of resilience as a guiding principle for those investments. Please, Carl.
Thank you very much, and thank you very much for inviting me. I just wanted to say a few words. That I'm calling from a country whose health system is carried by two development banks, ADB and the World Bank. And on the UHC day, it's the most inequitable health system in the world. And here I'm talking about Afghanistan. So we are spot on the topic we're going to talk about. So I'm going to, next one, talk about resilience of health system. Now, what I would like to do is to try to give you a bit of some definitions and hopefully some food for thought I work on research. I'm a researcher, so apologies for the concept and the definitions, but hopefully they make sense to you, you practitioners and people working in development banks. So the theories behind the resilience or type of resilience I'm talking about are very much based on system thinking and complexity science, where the environment and the future is quite unpredictable and quite uncertain. So these are the kind of paradigms that we have. And hospitals and healthcare facilities are considered as complex adaptive systems. There are a lot of feedback loops between the context and the hospitals, but as well between the hospitals and the context. The hospitals can influence the context as well. These are the kind of paradigms that we are using to think about resilience. Next one. So pass this one, next one. I'm going to be a bit. So in a nutshell, when we talk about resilience, it's all about the capacity of the system to continue to function given external shocks. And the shocks can be quite substantial, a pandemic, for example, a financial crisis in New York, or there could be stresses as well. So the intensity and scale of the shock is going to actually define the variations happening in the system. And the system can be as small as a health center or as large as a national or regional health system. Okay, so you can define your health system as you wish. Next one. The way of doing that, I'm going to use engineering, economics, and complexity science. So in engineering, for example, they have some very interesting concept related to the measure of resistance, elasticity, and the stability of the material. What they look at how the properties of, and you can imagine in your mind a brick of steel, for example, that you're going to heat, and whether or not this brick is going to change shape. And then as soon as you stop the heat, it's going to recover exactly the same shape. So the property is going to stay the same. In economics, next one, they talk about the maintenance of the functions. And in our case, for example, in healthcare, it's very much the functions of delivering services in a very equitable way, for example, okay? So that could be one way, but you can have other measures of performance related to low emission of carbon and green hospitals, many other functions you can bring here. What in economics, they don't have any fixed normality. They think that actually there's a lot of changes happening in context, and actually these small changes happening are going to bring variations in the properties of the system. And this is why they talk about self-organizing properties of hospitals, systems that always adapt to a changing environment. Next one. And the third one, it's very much a combination of these two, trying to combine the properties of the system with the functions. So the objective of hospital, for example, to deliver care. The properties can change over time, and it doesn't really matter as long as the functions are going to be delivered, but they're not going to be delivered the same way. For example, change of epidemiological patterns in the population. So you need to bring new services. You do not want the functions to stay the same over time. And this is where they talk about adaptability, the adaptive capacities of the system to change not only the properties of the system, in our case, that could be management, for example, and in order to change the services so that they are fit with the needs of the populations or the new needs of the health system, low emission carbon, for example. Next one. And this is just an illustration that we had in one paper where we try to understand the level of transformation that we have depending on the intensity or scale of the shock or the stress. So we talk about absorptive capacities when the shock is the stress or the shock is not very high. So you make a few adaptations, and then as you move along, as the shock is more and more important, like a pandemic, for example, there are huge transformation happening into the system. And what is going to happen after the end of the shock, after the end of the pandemic, would have transformed hopefully in depth, the way we deliver care, for example, in our countries. Next one. This is just an example of how the properties have changed. We use this kind of complexity or system thinking methodologies. This is an example with social network analysis, where you have on the left-hand side in Ghana, 5 districts, health district delivering, at that time, it was about cataract surgeries, trying to understand how all these network of facilities work together, hospitals, regional hospitals, district hospitals, and health centers, and how they make sense. And then at that time, on the left-hand side, you had an international organization here to try to create connection between all the different facilities. And then they disappeared. And 5 years later, I went back and looking at the transformation happening into the system. As you can see the 5 branches of the 5 districts coming back and very visibly. And as a center, you've got the regional authorities. So the properties of the system are completely changed. So we can try to illustrate that in different ways. This is just an example. Next one. When we have the foundations of care, as Agnès described, very much about infrastructure, human resources for health, very, very important. And then when we need to have that in a country like Afghanistan, I'm disseminating, validating a study that we're doing now on primary healthcare and the role of district hospitals into this network. We realize that we need to have the health system to be performing first, and then they can be resilient. And when we talk about the foundations that are now here, for example, in countries that in fragile situation, for example, it's very hard then to try to build resilience. Here we have defined a few dimensions on how we can manage resilience. And as you can see, it's nothing to do with inputs. And that I hope I can inspire a little bit the development banks on how they can invest in some of the soft dimensions of hospitals and management in order to make sure that knowledge, data is going to be brought to people who have to make decisions, creating interdependence that are not, that can be valuable in order to have access to information or to cope with different shocks, for example. Also to increase the legitimacy of the actors of the hospitals within the network of facilities and within the communities, and dealing with uncertainties by forecasting, anticipating what is going to come. And all of that could help mitigate the effect of the shocks and anticipate them in order to build the resilience of hospitals or healthcare systems. Next one. That's going to be my final slide. Resilience is very much an intellectual construct. Okay, we try to make sense of it because we have realized over time that actually these capacities are quite needed in order to mitigate the shocks and also to transform what we need to make hospitals more adapted to population's needs. We also have a lot of questions related to what are the main factors affecting resilience, for example. How can we measure resilience? We still have a lot of questions. We are currently developing one, but we're still at the very start of it. And also a lot of questions related to management strategies to enhance resilience in different structures, systems, hospitals, or primary healthcare systems. So I'm just saying there's still a lot to explore, but we need to invest more in this area. And I stop here. Thank you.
Thank you very much. Indeed, thank you for giving us this conceptual framework and putting all of this in a very nice and clear presentation. Indeed, it's really about the capacity of our health systems to function under shock, as you said, and to be flexible. So I'd like now to go to practical insight, and I'm very proud and happy to give the floor to Dr. Semakula from Rwanda, who will speak to us about his point of view regarding the main challenges that healthcare services face and which response are these players building towards an upcoming transition agenda? Dr. Simakula, please.
Thank you very much. As you mentioned, the health strengthening is very important, but also there is this dynamic that are changing. So going straight to my slides, I would like to tell you about a little bit about Rwanda for those who are not aware. Rwanda is a country in East Africa of about 13.2 population size with a GDP that is growing between 7 to 8. And we have official language as Kinyarwanda, our natural language, but French and the English, as well as the Swahili, also they are our national language. And then it's a second country in terms of doing business, according to Doing Business 2020. And the literacy level is about 79%, and unemployment rate is at 21%. Is a very safe country, mainly for the female. It's ranked the second globally on the safety country for female. Next. So in terms of the changing, the epidemic change, we have realized that in last few years that we are facing a dual burden of disease. That means there is an increase in terms of mortality due to non-communicable disease as compared to the infectious disease. So currently we are still seeing also the high rate of maternal mortality that is stagnant over time. And we are seeing non-communicable diseases increasing. So now we are dealing with a dual burden of disease because the infectious diseases are still there, but also the non-communicable has increased. And this requires a rethinking on how the health system should be working, especially in developing country like here in Rwanda, where before we used to have a lot of non-communicable, infectious disease. And our system were more trained and strengthened to deal with infectious disease. Now we need to reshape our health system to ensure that the system is adapted to the current change, including the changes that are due to the climate change. Next. So in fact, what we are doing now to strengthen our health system in Rwanda, there is 4S that we are trying to optimize. One, staff. We are trying to produce and make sure that we retain the number of health workforce that we are developing. And we have now currently a reform that is known 4x4. The 4x4 is to quadruple the current health workforce in next 4 years. And we are trying to bring several projects that are helping us to have a number of the health workers that are meeting the need that we have, but also with high quality, which requires innovative. And the second element is more on the space. Our health facilities need to be adapted, resilient to the climate change. There is a complete renovation and upgrade that's need to be done to ensure that we are adapted to the climate change. But also there is the Kigali Health Medical Tourism Hub that we are building in Kigali to attract research, but offering high quality health research and services in Kigali. There's also stuff that requires strategic acquisition of equipment. When you look on how the acquisition of medicine and other things have been done in the past, there is a lot of inefficiency where now the government and Rwanda has decided to work directly with the supplier, the producer, the manufacturers, so that we can increase the quantity as well as reduce the cost of services. There is also systems that we need to strengthen, mainly primary health care, because it's important that the diseases are detected at area, but also nearest where the population lives. So those are 4 reforms that Rwanda is going on, and you can also details next. So some of the climate and health and investment agenda to enhance resilience and the health sector that currently Rwanda is doing, the number of about 7. So I will go very fast in each. One is to build affordable house unit around secondary level 2 teaching hospital and primary hospitals. This is very important because some of the doctors, they need to, you can't retain them if they don't have housing across the hospitals. And we will find that in most of developing countries, the trained medical doctors, they are always in urban. Then the rural areas, they don't have professional doctors, and that affects the services on people living in rural areas or remote areas. Second is the e-mobility, where we are trying to see how can we find the electronic mobility to reduce the carbon emission, to facilitate the health staff in transportation, also in health facilities, to ensure that people are using the climate-friendly mobilities in health facility areas. Another element which is very important is the waste management in in hospitals and so on. And this is a continuous problem because the channel of managing waste management, if it's not thought carefully, it creates also other problems. We are looking on how can we use some of the climate adaptive methods to deal with the waste management. Here, increasing generating rapid, turning biohazard waste into useful materials that you can use maybe for cooking and other things, but also environment friendlies that we are trying to put in place. Next. So the fourth one is to see how our primary health facilities can use off-grid solar system just to support primary health to operationalizing the health post, mitigation of reduction of emission, that is also very important. Given that also we are likely sit in the place where we have the sun and so on, we can take advantage of these solar systems to ensure that we have enough energy. The climate smart infrastructure that are very important at all health facilities to ensure efficiency, but also the cost saving, support strategies, and so on. Modern hospital chicken, that are very important. Next. So when you look on the area of potential support for development banks to support Rwanda agenda, we summarize them into those elements. One is strengthening the healthcare resilience, which is very important. The second is targeted investment in hospitals, where look on develop climate sustainable resource efficient hospital. And then the third is finance and technical assistance to see how can we mobilize long-term investments to expand the hospital's network, improve healthcare delivery on underserved areas. And then there is also promoting innovation and sustainability and facilitate partnership on knowledge sharing. Next. So those are the 5 elements that we can still elaborate and see how can we partner together to ensure that our climate adaptability in health system is done properly and invest where the needs is, as well as keeping the climate friendly health facilities. Thank you very much.
Thank you, Dr. Simakula. Thanks a lot indeed. I really like your slide about the 4S and the 4x4. I think it's a very a striking way of describing clearly the system that you are presenting. I like also the fact that you underline the importance of waste management, for instance, which is sometimes something that is not always taken care of very properly and can be a question to different ways of managing the issue. I think we are more or less on time with the schedule, and I believe it's now a good opportunity to have some questions being asked. We have 5 minutes for this, and maybe I can start with one of the questions that was presented in the chat. I believe there was a question for Carl about what he presented in Afghanistan and how equity focused on initiatives. Is there anything that Carl could mention about this?
Yes, absolutely. It's a completely relevant question for Afghanistan, where 30% or 40% of the population, depending on the services, do not have access to healthcare. Huge improvement over the last 10 or 15 years, but still there's quite a lot of work to do. And yes, there are quite a lot of geographical areas that are not covered by network of facilities. So there are a few strategies. Community health workers is one of them. Another one is about the mobile health team that has been tested and with success in Afghanistan to cover what they call the white areas, the underserved regions. So yes, equity is a huge issue, and financial protection is a big, big problem in Afghanistan. 75% of spending comes from out-of-pocket payments.
Thank you, Carl. This is very clear and very striking again. I see that in the Q&A window, we have two questions. One regarding the resilience that you presented and whether there are any emerging trends or innovations that can amplify resilience in healthcare.
Yes, so the question coming from Donna is excellent, and that's exactly where we are now, exactly at the same level of thinking, is that how can we talk about resilience when health systems are not performing very well? So the basics are not here, the foundations of care are not here in terms of resources, gaps in care. And so we think about resilience as a kind of performance plus capacity. Interesting. However, if we look at some of the functions of some of the properties, if we try to differentiate some of them in one hospital or one district health system, then we realize that actually some of the properties or functions are actually going very well. So yes, the overall performance is not great in terms of service delivery, quality of care, outcomes, or equity, for example, but actually some of the functions can actually function very well, and this is as well the kind of nuances we need to try to bring so that we don't put everything in the bin. Actually, parts of the system are functioning very well. There are other parts where we need to invest more. It could be on the skills of the healthcare workers. It could be on quality of care, as access to care, for example, could be quite important.
Thank you, Carl. Maybe I'd like to give a minute for any of the 84 participants to take this chance, this opportunity. So I see another question now. Whether in the current context, can development banks improve the progress towards UHC despite the plateau that Agnès was mentioning earlier? Please, Agnès.
Thanks. I think this is really an excellent question. I'm really happy this was raised, because this is certainly one of the main motivations for encouraging and supporting the development of this platform. This has been quite some time now that we are plateauing at half of the world having access to the most essential services. And here we're not talking about an extensive package of comprehensive health services. We're talking about 16 indicators, most of them quite simple. One of them just being, are there enough health workers and hospital beds in the country? Another one is, are children vaccinated? Another one is, are people who have hypertension, are they being diagnosed and treated? So this is not about a very complex healthcare system, but even then, it's only half of the world. And this is a realization during COVID that we had major blind spots in the way we were investing, that in fact, the hospitals in particular, the specialist care, but also how recently technology has changed the way we see and we build hospitals, and that the hospitals of the future will be very different from what they were certainly in the 20th century. And we see that already in some countries, how they developed both in the way they are organized, in the architecture, in the materials used, in the way they function, in the way they shift to outpatient care, rather than, and they cut inpatient stays. So the question of how on how do we move forward is really the question of reinvesting health systems. I think what has been forgotten is that the half who don't have access are completely different from the half who have access, right? So there is a sense in the global community, and certainly I've been part of this for many years, to just say, let's do more of what we're doing for the 50% who have access, and that's going to give access to the other ones. And that's not true. It's not working. What we need is work differently for the next 50%. And one of them, it was mentioned, is linking the investment in health systems with investments in social protection, and really addressing the demand side as well as the supply side. Another one is really to rethink the way we provide services, and that's this big question about hospital care. And the third one is really to reinvest the question of skills and human resources. We have a major global shortage of human resources. Some countries are making a dent, but we still haven't really, in most countries, identified how to go about providing services and developing the kind of cadres that can help provide services to the poorest and the most vulnerable, and how new technology will help that. And here there is the big elephant in the room of AI, and what AI is going to do in terms of completely changing the approach to deliver services. And that is also changing the type of profiles of skills that will be needed in terms of delivering health services. So really that call about profoundly changing the way we invest in health from what we were doing until 2019 and the world was hit, and that this will have basically three main components. One is really reinvesting the link between social protection and the supply of health services. Second is really reinvesting public health and public health institution, and thinking on how really do we move towards prevention and promotion with different cadres of health services. And third is really that investment in a new type of infrastructure services that will be aligned with the new technologies benefits, but also the question of climate change and emergingly different epidemiological profiles. So that's really certainly the one answer. The three words answer is invest differently from before.
Thank you. Thank you, Agnes. This is very enlightening. I think we're going to now switch to the second part of our session. But before that, I'd like to benefit from the presence of Dr. Simakula to ask him whether he could actually maybe explain to us which specific and global investments in the hospital agenda shall the development partners prioritize?
Yeah, thank you very much. Yeah, indeed. When we start maybe with the the global investment, when we are talking about good health and the well-being, and we are seeing how the life well-being of people are affected by climate or by the environment that we are having. I think that's where we should start tackling, see what are innovation in hospitals that we need to put. One is that look on the energy that we are using, look on the greening for the hospitals that we are using, but also look on the waste management, because some of countries, people that get diseases even from the hospitals due to how the settings is. So look on the industrial investment and the innovation that they are doing. That is really very important and preliminary. And then another element that is very important, it's on the human resource that is really adequate and that is trained to offer those kind of services. So those are the areas that I really think we should focus on, but also making sure that the equipment that are coming at hospital are climate friendly. Some of things that we are using are not really climate friendly, and it's end up affecting us. And that is area that we can work on, but also we gain win-win from both supply and also the consumer, because when you look the energy friendly methods are more effective, but also everyone gain from it. Thank you.
Thank you, Dr. Simakula. Very, very challenging indeed. I believe that now we have set the stage. We have looked at the conceptual framework. We have benefited from the experience of Dr. Simakula. I'd like maybe to come to what are the efficient solutions that we can think of. And in that respect, we have two speakers this afternoon who will take the floor now. And I'd like to call Tata Sumirat from PT SMI in Indonesia to tell us more about the solutions. Please.
Oh, thank you very much for the opportunity. I think it is an honor for me to have to be able to speak in this special group, so whereby the professional can share their experience to contribute to the development of healthcare infrastructure on all over the world. And what I'm about to share is basically our experience in Indonesia, perhaps can be said as the emerging countries, where the role of National Development Bank can boost healthcare infrastructure development. Of course, this perhaps is not an ideal or best practice, but I think this is the best that we can get in a limited environment. So I would like to start by providing explanation about our bank or our institution where I work for the past few years. It is called PTSMI. It's a 100% financing institution under the Ministry of Finance. So it's wholly owned by the government. And we have three business pillars, what we call. First one is the more commercial financing, similar to other financing institutions, whereby we provide various types of loans. And second one is a public financing product. I think this is quite peculiar in our context, whereby we can provide financing to local government or other government institutions. I think this is what makes us different to other financing institutions. And third one, also our unique proposition, whereby we can have various advisories to both private and public institution, especially on PPP project. And I think one of the most important or useful products is whereby we provide assistance from the donor or multilateral institution, from international partners, and channel it to local governments. Yeah. So as you can see on the right-hand side, we have eligible infrastructure sectors, and of course, healthcare is one of our focus. So the additional information from this slide is that we, PTSMI, currently is still under the context of limited liability company, so not yet similar to our partners, whereby they are more public institutions. But then we aim to transform ourselves into what we call mini World Bank. So if World Bank provide financing to the countries, we want to provide financing to local governments and focus on their infrastructure, especially or including hospitals. Yeah. As of today, our financing portfolio is still dominated by toll road and electricity or transportation, yeah, because I think this is where the profitable assets are, and social infrastructure is still one of the least sectors, so to say. The proportion is still minimum compared to other sectors. I think this is also probably because our current context, our current setup is still underlying the company moving on or next. When we are becoming a full development financing institution, we can then more focus on the social infrastructure, including the healthcare facilities. I think this is also our focus for the next few years, whereby we will transform ourselves into a full development finance institution, whereby our proposition is to provide development impact, so not only looking for profit, but also this impact, and we want to provide end-to-end solution. And in our operation, we focus not only profit, but also people, planet, and prosperity. I think this is very much in line with the goal of healthcare infrastructure development. And so our strategic goal is to increase the portion of municipal financing. And in those financing, we want to become the agent of sustainable development to improve national welfare. Doing that kind of mission and strategic goals, of course, we cannot do this alone. We need to partner, or we need to team up with various institutions, with our seniors like the World Bank and all that, whereby they have a lot of more experience than us. So we can learn many things from them. Yeah, but this is our positioning so far, whereby we want to optimize the economic and social benefit with the risk management that is quite manageable. Yeah. So we have various positioning here. I think what I want to highlight is that we have managed to become several institutions in Southeast Asia, acted by DCF, establishing or pioneering green bonds. All these achievements basically are our effort to become a fully development finance institution. But I think, in short, the goal is to have or to tap various international support, because that's the only way for us to serve the domestic needs, especially on healthcare infrastructure development. The needs are abundant. We have huge country, we have a vast population, and to do this alone, I think it is quite difficult. So we need to team up with various, and we need, in order to achieve that, we need to have these instruments, so to say. So far, we have learned that in order for us to tap various instruments, either it's grant or loan from various institutions, from international development banks, I think there are some, challenges and opportunities. For example, when it is a grant, then usually the challenge is to make adequate timeline to match. Usually in loan there are more process, but comes with bigger amount. The grant usually it comes with small portion. But either of this instrument, it has its own standard, or especially on environmental and social safeguard. Yeah. So this is what we've learned so far, and that's why we have developed our own internal safeguards, so that it can match with various standards. We have World Bank standard, IFC standard. All those standards need to be fulfilled. And for us here, when we work with different partners, we need to switch between one standard into the other. So that's why we try to build our own standard. So this is the typical instrument that we tap, or we collaborate with international partners, grant and loans. There's specific to Indonesian context about loans, but yeah, usually loans take more time. Yeah, it has its own pros and cons. Yeah, but unfortunately, this is Unfortunately, this is the two instruments that we need to have in order for us to boost the infrastructure development in Indonesia, including on healthcare sector. But then we managed to pull or to make one what we call the showcase in the financing for healthcare infrastructure. This is one of the hospital, as you can see here. For the loan for the construction itself, it got loan from AIIB and the World Bank. So apologize, there's a typo there. It should be 10 million plus 10 million, so it's 220 million US dollar for the construction. And then for the feasibility study, and then for the environmental and social and do detailed engineering design, all those project documentation are supported by Swiss SECO through the World Bank to us. So we managed to tap this grant. And then for the other components, we also ask the local governments and the national governments to chip in. So as you can see here, there are various sources of funding to collaborate in order for this hospital to be established. Yeah. So this is back in 2018, and now the hospital already operational. As you can see on the below picture is the model, and on the top of it, this is the real world or the physical infrastructure of this hospital. One thing that I want to say is we can do this, but then we need to multiply the effort so that we can replicate. This is only one of the provincial government in Indonesia. So if you want to serve the nation, then we need to work more with various partners, various local governments. Hopefully, can replicate the same model. And as a conclusion, I think we as a development bank or development financing institution, we need to work beyond financing. So I think DFI or development financing institution need to have cross-cutting and client operational approach. Like my example previously, they don't know how to do the project management, proper project development activities. So we provide them assistance in, for example, preparing feasibility study. It happens in countries like us, yeah, perhaps. So we need to know their needs. So the focus is not to make the loan prepaid, but also we can also fulfill other goals. Yeah, meaning in this case, developing the capacity of the local staff there. And the other influence that we can think of is also, contribute to long-term public policy dialogue. So what we had experienced is on the local level, we talk with the local governments about the needs to have local doctors. Yeah, so they provide scholarship for the local doctors to go abroad, for example. Then after several years, they need to go back and serve their area. Last but not least, we also need to have a collaborative effort in order, like I said before, we have more than 500 local governments, and most of them need some support in one way or the other way around. So working with partners, I think that's what we aim. That's what we've been doing so far, because the resources needed is enormous. So we work with our senior, what we call the World Bank, the ADB, and so on. And last but not least, we also ask them about best practices, so they can share not only loans to us, but also some, financial management. Even we do the exchange program. So all these activities, I think, hopefully can serve our purpose to become the development banks of Indonesia, focusing in healthcare infrastructure. I think as one of the sectors, among others, is healthcare. So hopefully that's what I can share, and I think I look forward to further discussion.
So we will probably move to Denis Farzi, who is a Senior Investment Operations Specialist at the AIIB, and he will tell us about their perspective at the bank about those potential solutions. If we can switch to Dr. Fauzi's presentation. Thank you.
Okay. Thank you, Thomas. Good morning, good afternoon, good evening, colleagues. It's good to be here, and thank you to AFD and IHF for facilitating this webinar. So I think maybe Tata is also the bandwidth of the internet connection is already exhausted, because Tata's time is already 9 p.m. Jakarta and Beijing time is now 10 p.m. Jakarta, 10 p.m. in the evening. So, and this would be my 7th meeting of the day, and I hope it's going to be the last one. But so my apology in advance if I look and sound tired, but I'm very much excited to share with you what is the AIIB contribution to the issues that has been mentioned by the previous panelists. So I hope my voice and the slides is okay, Thomas?
Yes, please, please.
Okay, so next slide, please. So for those who are not familiar with AIIB, the Asian Infrastructure Investment Bank, allow me to just share with you one slide on what is AIIB and what is our vision, mission, and corporate strategy. So although we are the youngest, one of the youngest multilateral development bank, but right now we already have 110 economies in the world, which covered Asian and non-Asian countries. So we have vision that we would like to emphasize on the prosperous and sustainable Asia by advancing infrastructure and fostering human capital. And our mission is to do what we say as infrastructure for tomorrow, which integrates innovation approach to address global challenge, including climate change and healthcare disparities. We have several pillars. One is green practice, connectivities, technologies, and private partnerships. And I believe these are the pillars that has been mentioned by the previous panelists as an important elements of how we can do more contribution to the global health sector. Next slide, please. So although we are relatively new, but we are considered to grow in terms of our investment in driving the health infrastructure. So as you can see that we have invested around $1.1 billion of healthcare project focusing on health resilience, equity, and sustainability. We are fostering a collaboration, partnership with other MDBs and IFIs to address the health infrastructure challenge. And during the COVID pandemic time, we deployed $20 billion for crisis recovery facilities for vaccines, healthcare, and economic support. And in addition to that, for instance, that we tapped the first AIIB Global Infrastructure Facility Grant for Bangladesh Digital Health, accessing newly pandemic fund to increase the grant element for the Cambodian One Health project, mobilizing what we call the Multilateral Cooperation Center for Development Finance for regional cooperation and trade. And of course, we always open to do our collaborative and partnership with other institutions such as Global Fund, Bill and Melinda Gates Foundation. Next slide, please. So today is a big day for AIIB because with the collaborative effort of our health expert, our board of directors just approved the health strategy. So what is the bank health strategy? The bank health strategy is to emphasize on comprehensive approach, strengthening system across the healthcare value chain by targeting underserved regions. So we seek how to bridge disparities and ensure equitable access for health services. And by its core, to have sustainability, to have its initiative integrating climate resilience and eco-friendly practice to build robust and adaptive healthcare infrastructure. Next slide, please. Next slide. I don't know whether that, okay. So, I mean, health itself, it's very complicated. So for instance, if we look the health sector value chain horizontally and vertically, it includes various dimensions. So our intervention will be through financing the key output components by health system, medical products, technologies, and we also recognize the mega trend for demographic, socioeconomic, and disease pattern that shape the health system. So that's why we also focus on combating the threats to public health, such NCDs, and also primary health, how to strengthen the primary healthcare, and also for the infectious disease. Next slide. So these metrics just give you an idea on how we work and how we contribute to the global healthcare system. So on the left side, you see that we listed all potential subsectors. And on the right side is the thematic priorities for sort of the criteria combination of regional context. So in terms of the regional dimension, the best way to mitigate the damage for the global crisis, multi-collaboration is proved to be the key. So when the pandemic happened, stimulated more interconnected world through accelerated cross-border sharing data. And on technology, I think it was mentioned earlier that how we can do AI. So digitalization combined with AI can help reforming the clinical practice, service delivery, hospital management. And even with the big data that we have on the health sector, it can be used to produce key knowledge for physician, researchers, regulators to make their decision. So on private capital mobilization, and this is something that the AIIB has as maybe a bit of differentiation from other MDBs where we have sovereign and non-sovereign in one umbrella. This could be one factor that could help us later on to bridge the gap in terms of the capital, technology, and the know-how. Next slide. Okay, I only have 2 minutes left, so I will try to do my best. So when we develop a project, we have to understand first what is the needs of the country. So in this case, we can start with the gaps by focusing diagnostic facilities of healthcare facility access. So in the photo, it showcased that one of the examples that the project that we're about to do, how we transform the facilities on comprehensive manner, where we develop adequate infrastructure, we provide them with advanced medical equipment, as well as improving the capacity of workforce. And this is something that has been mentioned by our colleagues from Rwanda. And how to enhance, in the end, the products that we would like is to have enhancement on the healthcare delivery. And we provide different modalities of financing. Next slide. So I don't know, okay, the slide is not showed yet, but as an MDB, we recognize that health infrastructure and sustainable economic development are interconnected. So that's why in the project, we try to integrate climate resilience into healthcare, addressing challenges like air pollution, water scarcities, the waste management system, how to do more eco-friendly renewable energy as part of the green hospitals. So with that, we hope that it can affect the economic activities and development of healthy people. Next slide, please. So this is a very interesting project that we have, and this is not AIIB project per se. This is a collaboration of 4 multilateral development bank between the World Bank, Asian Development Bank, AIIB, and Islamic Development Bank. So this is the largest health project in the world because it's financed $4 billion, $4 billion US dollar. It's just approved last year. So the project is ongoing, and I'm the project team leader from the IIB side. So we feel that this project later on, if it's successful, we're going to draw on many lessons learned that can maybe reshape the foundation on how we do project in the future. So I believe that this is something later, if the colleagues are interested, from time to time, we can do some kind of a demonstration on how the project progressing. Because from the start, I was there and since day one, even for the preparation itself, we need around 2 years to have this project to be approved. So now we are on the first years of implementation, and with that, we have a lot of interesting things happening from multi-dimension aspect of project implementation. Next slide. Okay, next slide. Okay.
We see your conclusion.
Yes, this is my conclusion. So we are always open for partnership. We're looking for doing new innovation, make sure that sustainability is always part of the project. So we believe, and I believe that I've been working as a practitioner in this development area for more than 20 years. There's no such thing as a silver bullet. So there's no Superman or super agencies that can solve any problems, and partnership is the key to answer our issues in this webinar. So thank you. I'll stop here and looking forward for the discussion.
Thank you very much. That's very enriching, and indeed you've touched upon many different aspects and many different practical issues that you have been dealing with. And they all raise many interesting questions. So now I'd like to maybe go to the window of questions, and I see that somebody's asking about whether we could reflect on digital technologies and how they could support education and training of the future workforce in the context that we've been talking about. Who would like to respond to this question on digital technologies?
If I may, Thomas, just to say, okay. Just to say that digital technologies is very important. So for instance, right now we are developing one project in Central Asia where we would like to develop schools, school for the country. So one of the aspects that we provided into the component where we are developing the feasibility studies, the digital technology. So, and digital technology means the first is you have to have access to the technology itself, right? It means that you have to have an internet connection. If you don't have internet connection, then you cannot have a good digital technology. So for us, we start from the beginning, how we can assess what is missing from the economies itself, from the members. And then after that, we gradually grow the infrastructure better. So again, I think it's important for us to have the accessibility first, then gradually you try to build upon that and how you advance the technology better. Thank you.
Thank you very much indeed. Maybe one more question that I see in the discussion window. Somebody would like to hear about how we are thinking about workforce development and relationship with health education as part of the ecosystem that we are working on. Maybe this is a question for, I see that Tata is back with us. So maybe I'll give you a chance to talk, and if not, maybe I can ask Christophe to respond to that.
Yeah, you can hear me clearly. You can hear me clearly this time, Thomas.
Yeah, it's a bit better, please.
So I turn off the camera. So we put workforce development as one of the key pillars. Yeah, so as a development finance institution, not only focus on providing financing for the construction, for example, but then we also provide trainings as what we call accompanying measures. Yeah, meaning that we not only want the money goes back to us, but also we want the hospital operational in full scale. So, for example, even small things like bookkeeping activities, training on hospital ITs. So those kind of ITs, those kind of trainings we provide to various hospitals in which we have provide financing, because in certain part of our country it is very necessary, although perhaps in part of the world it is quite common, but for us it's very useful. So we also focus on that kind of aspect. Beside, as a bank, you have to make profit, but then you also need to focus on people first.
Thank you so much. Christophe, would you like to give us a bit more from the World Bank perspective on that topic, or?
Yeah, maybe Thomas, but could you rephrase the question, because I didn't see it. So.
Okay, let me go back to the chat.
Instead.
So the question was about how we are thinking about workforce development and relationship with health education as part of the ecosystem in which we work. So what are the challenges about education of medical staff, human resources? We said that it is indeed, it's for me working in an investment bank, it's worthless building hospitals if there is no workforce to work in. As you know, human resources for health is the issue, in fact, beyond the resilience and the challenges that we've been talking about. So what is the perspective of the World Bank on that issue?
Yeah, thanks, Thomas. So quickly, yes, of course, I would share your finding. I mean that this is indeed the key bottleneck. I would tend to believe that it's a bigger issue than the lack of domestic funding, to be a bit extreme. And I one more belief that as much as we can, I mean, we need to help in producing many more, I mean, doctors and nurses. And I really insist, I mean, on the fact that should be qualified health workers. And then again, in my view, a major obstacle is not so much the lack of funding, is more about the fact that there are sometimes interest groups which don't want, I mean, this massive production to take place. I think that's an issue in many countries. I mean, of course, there is not too much, I mean, that development bank can do, but at least we can, I mean, support some policy dialogue on that. I would say also helping countries to make sure that when they have more health workers, they are used efficiently. I mean, in helping in reducing absenteeism or that kind of thing. But still, I tend to believe more and more that it's not just a question of money. It's just to help overcoming some very deeply entrenched interest groups, preventing this massive increase in health workers.
Thank you, Christophe. Thank you for taking the question indeed. And we have 8 to 10 minutes left. So what do we do now? Agnes, can you lead us the way on what is next, and how do we see the future of this initiative altogether? Please.
Thank you very much, and thanks for this great session. Thanks to all for their contribution. I personally learned a lot, and it's very exciting to see that we have here a group who is just really committed to take these issues on, because clearly the needs are immense. So if I look at the amounts of the Indonesia project, this is quite formidable, but it's one country. That means the needs in terms of investment in infrastructure and associated human resources, associated health workforce, as was said at the end, and it's a critical message, are really there. So thanks really to all the speakers, and also thanks to the participants who have asked absolutely fabulous questions. I think this webinar confirms the need for giving a better place to healthcare investments in the development bank's portfolio. I mentioned before that altogether development banks mobilize about 2.7 trillion per year. We don't really know how much goes to health in that, but if we are taking as the benchmark what the World Bank is allocating, or those who actually for which the data are immediately available, Asian Development Bank, other MDBs, us, Agence Française de Développement, KfW, we see that it is much less than 10%, right? So there is enormous space of progress for more investment in the healthcare sectors. And what I hear from the development banks who spoke during this webinar, whether it is the World Bank or the Asian Infrastructure Investment Bank, OCB, is actually the demand is really growing very fast. And that's really what we need to respond to. And the challenge has also put very squarely during this webinar. It is a very technical field, right? Hospitals are complex beasts. They are complex animals, and it is possible to spend a lot of money for projects that are difficult to implement, are slow to implement, and may at the end belong to this infamous category of white elephants. And that's what we want to avoid at all costs. We want to be able to learn from experience and share the experience with experts and practitioners, and really provide the best advice to government of where and how to spend the money on those investments, and how to really invest in the hospitals of the future, not in the hospitals of yesterday. And unfortunately, we know a lot is still happening in terms of investment in the hospitals of the 20th century. And I think this as we continue the discussion in this space, it is very, very critical to keep this group dedicated to understand better how to invest well. So I want really again to thank especially Carl Blanchett for his presentation, for accompanying the platform in its reflection to enhance these investments in healthcare systems, in the health systems of the future. And in order to continue the conversations, we've been talking a little bit offline, and we thought it's really important that we continue this conversation. We've created a group dedicated to financing and investments within the platform. The platform is not only about financing and investments, it's a lot about technical issues and policy issues. But we have included this financing investment platform, which is aimed primarily at development banks, all of them, big and small. And there will be two modalities. First is a peer group of some banks willing to invest some of their time to conduct internal exercises related to knowledge sharing, good practices, and writing documents. So this is really a call for interest of all the banks who want to invest a bit of their resources into that knowledge production and sharing. We will continue to offer these webinars. So this is the first of a series. So we'll have webinars several times per year, depending on what is proposed by the different members of the community. And based on this work, the platform will be promoted at the next Finance in Commons Summit, end of February in Cape Town. And there will be a Development Bank's position paper to enhance the investments, especially those belonging to the Coalition for Social Investments to join us for this future endeavor. Thank you very much again.
Thank you, Agnes. Thank you for giving us a perspective, indeed, for putting up the challenge of not building 20th century hospitals, but looking at the future. Thank you indeed for telling us about this position paper that you're envisaging and the next webinars. I'd like here indeed to thank all speakers who took their time, even late in the evening from Beijing, for accepting this invitation. I'd like to thank a lot the participants who dare to ask those questions. I think we're right on time to wish you a good end of the day. Thank you to all of you. Bye-bye.